Yeah, this is regarding the CONPET poster which we're presenting today. And the study is not about just consolidation in itself. The patients that were picked for these trials were the patients that were PET positive after transplant. We know most patients are PET negative, and we know that to be PET positive in this situation is a bad prognostic sign. So we picked that population to see if we can do something with their prognosis. It's a phase 2 one-arm trial. So the patients that were PET positive were treated with 4 cycles of carfilzomib-lenalidomide-dexamethasone. And safety-wise, this seemed very manageable. We had no patients stopping treatment. Of course, there was some dose reductions, but not many. We started the treatment usually between 3 and 6 months after the transplant. Efficacy-wise, the main outcome of the study is PET negativity after the trial. So before the treatment, all 50 patients were PET positive. They were treated with 4 cycles of KRD. And then we measured PET, analyzed PET again. So we saw that about 1/3 of the patients became PET negative afterwards. We also saw an increase in MRD negativity in bone marrow by NGF, next generation flow. So what we're doing now, since this is, first I would say that's a good result. These patients were still PET positive after induction treatment, after transplant, and that we were able to remove that PET positivity in 1/3 of the patients, I would say is maybe better than I thought. But since this is a one-arm study, it's difficult to compare the outcome with PFS, which we're still following. So what we're doing is that we did, at enrollment, we screened 150 patients, and 2/3 of them were PET negative. So those did not get KRD, they just got len maintenance as standard of care. So we now are going to compare these two groups. If we had compared them without KRD, we knew that the prognosis would be worse in the PET positive patients. But now when we're comparing to a PET negative group with only len and the PET positive group with additional KRD, if they turn out to be at least similar, it seems like we have done something with this treatment.